Today we will explore one of the most important biological concepts in radiation oncology, the 4R of radiobiology. This principle explains how living tissue responds to radiation and where radiotherapy is delivered in multiple fractions rather than a single large dose. Understanding this mechanism is essential for optimizing tumor control while minimizing damage to normal tissues. In next slide, introduction where radiobiology matters. Radiotherapy effectiveness is not determined by radiation dose alone. The biological response of cell play a critical role. Fractionated radiotherapy take advantage of difference between tumor cell and normal tissues. The 4R repair, redistribution, repopulation and reoxygenation describe the biological process that occurs between radiation fraction and form the foundation of modern radiotherapy treatment planning. Concept of fractionation. When ionizing radiation interacts with tissue, it damages cellular DNA. If a large dose were delivered at once, both tumor cell and normal tissue would suffer several damage. Fractionation deliver the total dose into smaller doses delivered over time. This allows normal tissue to recover while still targeting tumor cell effectively, improving the therapeutic ratio. Overview of 4R. The 4R of radiobiology describe key biological response to radiation. Repair refers to the correct of DNA damage. Redistribution describe how cells move together the cell cycle between radiation fraction. Repopulation involve the proliferation of survival cells during treatment. Reoxygenation refers to the increase in oxygen level with tumor after radiation exposure. Together, this process influence treatment outcome. Repair sublethal damage. Repair is the process by which cell correct radiation induced DNA damage. Many radiation injuries are sublethal and can be repaired if sufficient time is allowed between fraction. Cellular repair mechanism include non-homogeneous and joining and homogeneous recombination, which restore damaged DNA standard and maintain genomic stability. Next slide, repair differential tissue response. Normal tissue generally possess more efficient DNA repair mechanism than tumor cell. They also benefit from better blood supply and oxygenation. Because of this, normal tissue can recover from radiation damage more effectively than cancer cell. This difference is one of the major reasons fraction radiotherapy improve the therapeutic ratio. Redistribution cell cycle effect. Thus, cells are not equally sensitive to radiation during all phases of cell cycle. The most radiosensitive during the G2 and M phase and most resistance during the late S phase. After radiation exposure, Surviving cell progresses through the cell cycle as they redistribute into more sensitive phase. The become more vulnerable to next radiation fraction. Then redistribution fraction timing. The fast radiation fraction eliminate many of the most sensitive tumor cell surviving cell then continuous moving through the cell cycle. When next fraction is delivered, some of the cell have entire more radiosensitive phase, increase the effectiveness of treatment. This biological principle support daily fraction schedules. Then repopulation. Repopulation refers to the growth and division of surviving cell during radiotherapy. Both normal tissue and tumor cell can repopulate between treatment section. In tumor, this process can reduce treatment effectiveness if therapy is prolonged or interrupted. Then we discuss about clinical consequence of repopulation. The treatment of interruption can significantly affect radiotherapy outcome. Tumor cell may being accelerated repopulation after several weeks of treatment. This means the tumor start growing faster, making it more difficult to control. Therefore, maintaining the planned treatment schedule and minimize gaps is extremely important. Reoxygenation. Oxygenation play a critical role in radiation induction cell damage. Oxygen enhances the formation of free radicals that damage DNA. Hydroperoxide tumor cells which lack sufficient oxygen are therefore more resistant to radiation. Many tumors contain regions of low oxygen due to abdominal blood supply. Reoxygenation between fraction. After radiation treatment, many well oxygenated tumor cells are destroyed. This can improve blood flow to previously hypoxia region of the tumor. As oxygen level increase, the cell become more sensitive to radiation. This process is called as reoxygenation and improve the effectiveness of subsequent radiation fractions. Integration of 4R. The success of fractionated radiotherapy relies on the combined effect of 4R: repair, protect normal tissue, redistribution, increase tumor cell sensitivity, repopulation, influence treatment planning, and reoxygenation, enhance radiation effectiveness. Together, these mechanisms help maximizing tumor control while minimizing damage to healthy tissue. Understanding the 4R help clinical design optimal treatment schedule. Conventional fraction, hypoperfection, accelerated fraction are all based on radiological principles. Modern radiotherapy technique also incorporate must adopt strategy that responds to biological change during treatment. Recent research suggests that additional biological factors may influence radiation response. These include intrinsic radiosensitivity, immune system activation, and the tumor microenvironment. Radiobiology continues to evolve as a new discovery, improve our understanding of how radiation interact with living tissues. Then we come to last slide. Thank you for your attention. Understanding the 4 hours of radiobiology is essential for one involved in radiotherapy, medical physics, and radiological science. These principles remain fundamental of improving treatment outcome and advancing the field of radiation oncology. Thank you.